If acne was one condition, we would have one treatment that works for everyone. But that's not what happens in real life. Some people follow routines consistently and still don't get stable results. Acne improves, then flares again, or one person clears completely while another worsens using the same routine. This usually leads people to think they chose the wrong product. But very often, the issue is not the product, it's how acne is being understood. So, one of the biggest mistakes in acne management is treating acne as if it's one condition. In reality, acne behaves in patterns. And if you don't identify the pattern correctly, treatment becomes very unpredictable. So instead of asking, what product should I use? A better question is, what type of acne am I dealing with? So when we talk about patterns, not all acne behaves the same way. The first pattern is inflammatory acne. This is the red, tender, reactive type. It becomes irritated easily and often leaves marks behind. If this type is treated too aggressively, we usually see more redness, more pigmentation, and slower healing. This is why some people worsen when they jump into strong actives too quickly. The second type of pattern we see is congestive acne. This is less inflamed but more persistent. People describe it as texture that never fully clears. You see clogged pores, small bumps, and even skin, but it doesn't flare dramatically, but it lingers. So, treating congestive acne, like inflammatory acne, often creates irritation without real improvement. Then the third pattern that we keep seeing is hormonal pattern acne. This is acne that follows a rhythm. It tends to recur in the same areas, especially the jawline and lower face. It settles, then comes back, often repeatedly. So this type doesn't respond well to random product switching. Yet that's what many people try at first. And very importantly, many people have mixed acne. So, not one type, but a combination. So, inflammation in some areas, congestion in others, and pigmentation alongside both. So, when one routine is applied to all of that at once, results become inconsistent. And that's when people feel like nothing is working. So, something else that is important is the location, which matters, which acne is misunderstood in that a lot of people ignore the location. Where acne appears gives us important clues. So, jawline acne behaves very differently from forehead acne. So, jawline acne is often deeper, more persistent, and tends to recur. Meanwhile, forehead acne is often more congestion related and many respond differently to treatment. While cheek acne is another category entirely, especially when inflammation and pigmentation are both present. If you treat all these areas the same way, you miss critical differences. So, what about severity? Because that's another common mistake is judging acne only by severity. People are told they have mild, moderate, severe acne, but severity alone doesn't guide treatment well. Two people can both have mild acne and need completely different approaches. One may have occasional breakouts that heal cleanly. Another may have fewer breakouts, but every lesion leaves pigmentation. So clinically, those are very different situations. Severity tells us how much acne is visible. It doesn't tell us how acne behaves. And behavior is what determines outcomes when it comes to acne. So why do treatments fail? Because this is where many routines start to fail, because most routines are built around products and not patterns. People copy routines online without understanding their acne type, their acne location, their skin response. So when the routine doesn't work, they assume they need something stronger. But often they needed something more specific to the behavior of the acne or pattern. This is also why routine that work beautifully for one person can completely fail for another. Not because one person did something wrong, but because they were treating different acne patterns with the same strategy. So once you start looking at acne this way, a lot of confusion clears up. Acne becomes less random, less frustrating. You begin to see why progress was inconsistent, even when you were trying your best. Because acne is not one condition, it's a group of patterns, and patterns need different strategies. So in the next video, we'll go deeper into something many people struggle with. And this is how to identify your acne type. So remember, consistent acne results usually come from correct interpretation before any aggressive treatment. So if this helped you understand acne differently, you can subscribe for more evidence-based skin education.